Hello everyone, Dr. Sam Schroetke here at Physical Therapy and Hand Clinic of Hillsborough with Technique Tuesday. What we're going to be doing over the next several weeks is offering a series of videos for people who are experiencing hip pain, or some of these same exercises can work if you're having sacroiliac joint pain. Typically, if you're having hip pain, it's going to manifest here on the front part of the hip. Okay? So if you've been diagnosed with hip pain and this is where your pain is, it's a very good chance that it is coming from your hip. Okay? Sacroiliac joint pain, on the other hand, is usually kind of in the upper buttock and down. If you're having pain up here, that's more likely coming from your low back or your lumbar spine. But pain kind of, there's that bone right there that kind of sticks out a little bit, protrudes out. If you go below that area, if your pain is in that region, it's more likely sacroiliac joint pain. If you are having pain on the side of the hip here, that could be hip pain, but I would encourage you to work with your physical therapist to try to rule out lumbar pain first, low back pain. In fact, if you want to see some of the other videos I've done on low back pain, you might try those exercises first, and if those get rid of this, then it's low back pain. If not, it could be your hip. All right, so the first three things I'm going to do 3 videos for hip extension. That tends to be the direction that most hips respond to, but I said most, not all. So don't take it as a blanket statement. Most hips respond to it, but not all. All right, so right now we'll say that I'm either having hip pain, so pain in the front, or sacroiliac joint pain kind of in this buttock region. Repeated hip extension. What I would do for this is put a pillow on the ground, because you are going to have one of your knees on the ground. You want to be next to a surface that you can support yourself on. So right-sided hip or sacroiliac joint pain. I'm going to get into this half kneeling position. Importantly, so my painful side is the knee that is down. So right now my right knee is down. I'm having pain in this right hip or sacroiliac joint. My other hand, my left hand, is going to be just here for balance or support. What you want to do, key with this one, is that front leg, you want it stepped out quite far, okay? And that's to get us into end range hip extension, and then all you're going to do is go pressure on, pressure off. Going as far as you can, pressure on, pressure off, pressure on. You might hold for 1 to 2 seconds, pressure off. Trying to go farther with each rep, farther. So this is an end range technique if you're going to respond to it. End range means getting that joint moved in this direction as far as you can. You're going to do 10 to 15 reps every 3 to 4 hours. Okay, so that's repeated hip extension and half kneeling for hip or sacroiliac joint pain. If you're having pain with sitting or squatting, when you get done, you might do 10 to 15 reps of this and recheck whatever was painful to see if it's any better. Okay? All right, so repeated hip extension and half kneeling. Check with your physical therapist or physician before doing this to make sure that it is appropriate for you. Remember with this exercise, getting that front leg as far out as you can. You're by a supportive surface. This painful side, the knee is down, and you're getting into hip extension. You're kind of lunging forward as far as you can, so getting as far as you can. First couple of reps might feel a little sticky or a little uncomfortable, and it should free up as you go, and you should have a pretty quick cessation or decrease in symptoms. If it didn't work, I'm going to show some progressions that might work better for you. Okay? Dr. Sam Schroetke here at Physical Therapy and Hand Clinic of Hillsborough. Technique Tuesday. Thank you.